The other topic which we are going to discuss is histamine and its antagonists. So, what is histamine? Histamine is a category of autocoids. What are autocoids? Autocoids, the name itself indicates auto means self, and it is derived from a word called ekos, which means self remedy or else self healing remedy, and this is a Greek word. So autocoids are the local hormones which when released into the body they produce some kind of allergens, or else they produce some kind of allergic reactions, and these autocoids are produced locally only. So that is the reason the word autocoid means local hormones or self-healing remedy. So, why are these autocoids produced? These autocoids are produced in reaction to any injury or else any inflammatory reactions. So when these autocoids are released into the body, they produce some kind of immunological responses, or else the immunological responses can be altered when these autocoids are released, and they produce some kind of inflammatory reactions, or else inflammatory responses can be observed when these autocoids are released into the body, as well as they serve as transmitters or modulators in the nervous system. They serve as modulators in the sense they modulate or else they produce some kind of changes in the normal immunological as well as nervous system also. Autocoids are basically of three types. One is amine autocoids, peptide autocoids, as well as lipid autocoids. Amine autocoids include two types. One is in the sense in the amine autocoids there are two autocoids, namely histamine and 5-HT, that is 5-hydroxytryptamine, which is also called as serotonin. And lipid derived autocoids include corticosteroids, prostaglandins, leukotrienes, and platelet aggregating factors. So prostaglandins, leukotrienes, and platelet aggregating factors come under the category of lipid derived autocoids. And peptide autocoids include the autocoids as angiotensin as well as plasmakinins. And in this plasmakinin examples include bradykinin as well as calidin. So bradykinin and calidin come under plasmakinins, which are released into the blood plasma. Let us see in detail about histamine. So histamine is a type of amine autocoid which is present in the tissues, or else histamine is released from the tissues, and this histamine is released from mast cells which are present all over the body, and mainly histamine is released from such a kind of mast cells which are present in skin, lungs, and GIT mucosa. So major kind of histamine is released from the mast cells which are present in skin, lungs, and GIT mucosa, as well as histamine is released from other cells also. Apart from mast cells, histamine is released also from other cells which are present in the brain as well as gastric mucosa. So as I told you, histamine is a tissue amino autocoid which produces several responses or several physiological processes. So mainly it shows local immunological responses, and it shows inflammatory reactions as well, and it regulates physiological function of GIT mucosa. So in the GIT mucosa, as histamine is released in the GIT mucosa, so it produces some physiological responses and pathological responses in the GIT, as well as it mediates immunological responses in various kind of diseases or disorders, and even in the normal human being also immunological responses can be altered when histamine is released into the bloodstream. So, and it is a biological amine which is also present in plants and animals. Histamine is not only present in humans but is also present in plants and various other animals also. And when coming to animals, it is mainly present, or else a large amount of histamine is present in venoms or else stinging fluids. So these stinging fluids and venoms contain histamine, and in the human plasma it is present in a very low concentration. It is also dose dependent. So approximately 0.5 microgram of histamine is released into the blood circulation, and histamine is excreted in the urine very frequently. If once the immunological responses or inflammatory responses are done, or they are terminated, then histamine is released histamine is excreted in the urine, varying from 10 to 40 grams for every 24 hours. Let us see the synthesis, storage and metabolism of histamine. Histamine is synthesized from an amino acid called as histidine, L-histidine, that is levo form of histidine. So histamine, on decarboxylation of L-histidine, it produces histamine. So L-histidine is an amino acid which contains carboxyl group, that is COOH group. On decarboxylation of this L-histidine, that when carboxyl group, that is COOH group, is removed, that is decarboxylation is done, then histamine is formed. And histamine is usually stored in the mast cells and various other cells also, but majority of the histamine is stored in the mast cells. And histamine, after showing its actions, it have to undergo some metabolism. So histamine undergoes metabolism in the presence of an enzyme called as N-methyltransferase. So in N-methyltransferase, methyl group is attached to one of the carbon of histamine, where it forms N-methylhistamine, and this further undergoes metabolism to form N-methylhistamine imidazole ring. Histamine release. Why or when is histamine is released? If there is any injury to the tissue, or if there is any inflammatory responses going on in the body, or if there is any allergic reactions observed, then histamine is released from the mast cells. So mast cells tend to produce histamine, and when histamine is released into the bloodstream, it produces some kind of allergic reactions in the body, or there are chances of potentiation of inflammatory responses because immune system is altered. So in immune system we find various B cells, T cells and various other cells which are present in the immune system. So these immune system cells are altered, or immunological responses are altered when histamine is released into the bloodstream. Let us see the mechanism of action of histamine. So histamine binds to histamine receptors. There are three types of histamine receptors: H1 receptors, H2 receptors and H3 receptors. So histamine binds to these receptors and exerts its actions. If histamine is binding to H1 receptor, then it produces an action called as increased in calcium, cellular calcium level. So when histamine is binding to the H1 receptor, then intracellular calcium levels are increased, whereby it shows contraction of the smooth muscle, contraction of the vascular muscles, as well as it produces sensory nerve ending pain and itching. So when calcium is overloaded, it sometimes produces shock also. So there will be alterations in the vascular muscles, smooth muscles, nervous system, as well as various other systems in the body. And when histamine is binding to the H2 receptors, there will be increased cyclic AMP levels. So in cyclic AMP, when it is increased in the body, it produces constriction of the smooth muscles. So constriction of vascular smooth muscles, constriction of bronchial muscles and constriction of various other smooth muscles takes place when intracellular cyclic AMP levels are increased. So when histamine binds to H2, there will be increased cyclic AMP levels. And when histamine is binding to H3 receptors, there will be decreased cyclic AMP levels, where it causes vasodilation, bronchodilation and various other smooth muscle relaxation takes place when histamine is binding to H3 receptors, because it causes decreased cyclic AMP levels. Let us see the pharmacological actions of histamine. So histamine, when binding to histamine receptors, it exerts its actions on various tissues. So what are the actions of histamine on cardiovascular system? So when histamine is released into the blood circulation on cardiovascular system, it produces or it causes dilation of arteries, capillaries, arterioles and various other venules also. There occurs dilation or relaxation of the vascular smooth muscles when histamine is released into the systemic circulation. And this histamine is given in two routes for cardiovascular diseases, or it exerts two actions when it exerts various actions when it is given in two different form of routes. One is intravenous route and the other one is intradermal route. So when histamine is given in IV route or it is given in the form of injection, it causes or it decreases blood pressure because it causes vasodilation in cardiovascular system. And when histamine is given intradermally, it produces triple response, or else it produces three kinds of response. One is it causes skin rashes, or else it causes red spots on the skin, and it forms wheal. Wheal is nothing but a rash, a circular or ring type of rash which is observed on the skin. And the third type of response is flare. Flare in the sense there causes increase in the overflow of or increase in the blood flow in the arterioles, where it causes redness in that particular area. On visceral smooth muscles, what are the actions of or how the histamine is affecting vascular smooth muscles or visceral smooth muscles? So when histamine is released into the circular system or blood circulation, it causes bronchospasm as well as it causes abdominal cramps. In the sense, it is causing constriction of visceral smooth muscles. What happens if histamine is released to the secretions? So histamine causes increased gastric secretions as well as histamine causes increased nasal secretions. So when histamine is binding to H1 receptors, it causes increased gastric secretions, and when histamine is binding to H2 receptors, it causes increased increased nasal secretions. So histamine, the secretions also, increase in secretions are also based on which type of receptor it is binding to. And what happens to the sensory nerve endings, or what happens in the CNS circulation or in the CNS system when histamine is released? Usually it causes itching because the sensory, it causes increased sensory nerve impulses in the sensory nerve endings, and thereby itching is observed. And in the CNS, in the central nervous system, it causes wakefulness. When histamine is released, it makes the person to awake for longer period of time due to the over-secretion or over-stimulation of the nervous endings. Therapeutic uses. Histamine is beta-histin. Beta-histin is a histamine agonist, and it has various uses, like when histamine agonists are given in the body, it causes antigen-antibody reactions, and thereby the histamine reaction is potentiated. For example, if histamine agonist like beta-histin is given, histamine produces constriction in the vascular smooth muscle when it binds to H1 receptors. So when these agonists are given, it causes or it potentiates vasoconstriction more. And when coming to secretions, there will be decrease the secretions, there will be increase in the secretions. So when histamine agonists are given, increased secretions are observed. So depending upon which type of receptor it binds to, it depends on what actions it produces. What are the adverse reactions or adverse effects of these histamine? So histamine, when it is released into the body, mainly it causes redness of the skin, or else redness of the eye, or else redness in the particular area where it is acting, and it causes itching, it causes flares, it causes redness or it produces rashes, and it produces wakefulness. So on CNS or in central nervous system, it produces wakefulness because of the overstimulation, and when it is present in the skin or when it is acting on the skin, it causes various redness or else various skin related rashes or allergic reactions. Histaminergic agonists. There are various histaminergic agonists. One is non-selective histaminergic agonist, selective H1 receptor agonist, selective H2 receptor agonist, and selective H3 receptor agonist. Non-selective histaminergic agonists include histamine and beta-histin. Histamine and beta-histin bind to any of the three of histaminergic receptors and exerts its actions. When coming to selective H1 receptor agonist, it includes 2-methylhistamine, 2-pyridine methylhistamine. So these are the H1 receptor, selective H1 receptor agonists. They bind to the H1 receptor only to exert the action, or else they imitate the action of the histamine which will bind to H1 receptors. And Selective H2 agonists. Selective H2 agonists include 4-methylhistamine, impromide and dimaprid. These are the histaminergic agonists which bind to only H2 receptors. They bind to H2 receptors and exert their actions. And H3 agonists include alpha-methylhistamine and imitate. These are the drugs which bind to only H3 receptors and exerts its actions. What are the uses of these histaminergic or else histamine receptor agonists? Histamine receptor agonists are used in a condition called as histapenia. Histapenia is a condition where histamine is present in lower concentrations or less action of histamine is observed in the body. So when histamine agonists are given, it potentiates or it increases the release of histamine and thereby it shows the actions of histamine. So histapenia shows symptoms like absence of sensile or inhalant allergies, because when histamine is present in the lower concentration, we can see less allergic reactions, and high anxiety and low libido. When histamine is present in lower concentrations, the person will be high anxiety and low libido. Libido in the sense he will be less socially attached with the people, and we can see multitude chemical or food sensitives. He will be very sensitive to various food as well as other drugs which when given to him when histamine is present in the lower concentrations, and he will have auditory kind of hallucinations. Hallucination is a condition where we observe that the person is having such a, we can say if the things are happening but the things usually doesn't happen. The person feels that the things are happening. So hallucinations are such kind of things. So the person will have auditory hallucinations. He will hear something which is not audible or which is not actually happening. Diagnostic uses. What are the diagnostic uses of histamine? Histamine is diagnostically used in the diagnosis of asthma, and it is used in sensory nerve function, and it is used in allergy skin prick test control, as well as it is used in gastric acid content diagnosis. When there is gastric related problems, or when there is asthma related problems or respiratory related problems, or when there is CNS related problems, then these histamine plays a major role in the diagnosis of these three diseases or disorders. So when we take a sample of the blood, and if histamine is present in the higher concentrations in any of these secretions, or if the histamine is present in higher concentrations in the blood, then based on the amount of histamine present, we can diagnose which kind of disease the person is suffering from. So this mainly useful in diagnosis of few of the respiratory, cardiovascular as well as GI disorders. Histamine antagonists. Let us see the histamine antagonists. There are H1 receptor antagonists, H2 receptor antagonists and H3 receptor antagonists. So the major class of histamine antagonists are H1 antagonists. H1 antagonists are present in two generations, first generation drugs as well as second generation drugs. In the first generation drugs, these are mostly sedative drugs because they cause more sedation, and the drugs like chlorpheniramine, diphenhydramine, doxylamine, hydroxyzine as well as promethazine, the one which are marked with red arrow, these are the drugs which have more sedative effect. And the drugs like cyclizine, doxepin, dimenhydrate, meclizine, these are the drugs which are indicated in green arrow mark. They are mainly used in motion sickness. And there are second generation drugs which are used, H1 antagonists. There are second generation drugs which are less sedative like cetirizine and acrevastin. Cetirizine also, levocetirizine is more recommended because levocetirizine have less or nullified sedative effect. And there are non-sedating drugs like fexofenadine, loratadine and disloratadine. These are the drugs which are having no sedation effect. H2 receptor antagonists. These are the antagonists which bind to H2 receptors like ranitidine, cimetidine, famotidine and roxatidine. These are H2 receptor antagonists. And H3 receptor antagonist, there is only one H3 receptor antagonist, that is thiopyramide. This is the classification of histamine receptor antagonists. Let us see the mechanism of these histamine receptor antagonists. They produce competitive antagonism. Competitive antagonism indicates these H2 receptor or else these histamine receptor antagonists, they competitive or they compete with the histamine in order to bind to the receptors, or else what does they do? These histamine receptor antagonists, they compete with the histamine agonists in binding to the histamine receptors and exert their actions. If for suppose H1 receptor agonists are there, they H1 receptor antagonists, they prevent the H1 receptor agonists to bind to the H1 receptors, and thereby they produce antihistaminergic effect. So here we can see histidine contain pyridine imidazole ring, and it is having methylamine ring which is attached to it. So these H1 blockers or else histamine blockers, they imitate the structure of the histamine agonist, and thereby they bind to the histaminergic receptors in order to antagonize histaminergic actions. What are the pharmacological actions of these histamine antagonists? So these also histamine antagonists also produce various kind of effects depending upon the type of receptor they get attached to. First kind of pharmacological action is CNS depression. So we saw in the classification, like few of the H1 receptor antagonists, they show sedative effect. So when histamine antagonists, depending upon first generation or second generation, if they are given, they show CNS depression. This is, they causes sedation or else they produce some kind of drowsiness, and if they are given in higher doses also, they show anti-Parkinsonism as well as anti-emetic effect. And it shows anti-allergic actions. The main action of these histamine receptor antagonists is to antagonize histamine. So when histamine is released, it produces allergic reactions. So these histamine receptor antagonists, they show anti-allergic reactions. And the other one is anticholinergic actions. So anticholinergic actions include dry mouth, constipation, urinary system variations. So these all are observed when anticholinergic drugs are given. So these histamine receptor antagonists show this kind of anticholinergic reactions when they are administered into the body. And let us see the pharmacological actions. I mean, the classification of these H1 receptors are given. The pharmacological actions are high, minimal as well as low. It depends upon the drug. The drugs like promethazine, diphenhydramine, diphenhydrazine, phenyramine and cyproheptadine. These are the class of H1 receptor antagonists which show high pharmacological actions, and there are few drugs like fexofenadine, loratadine, cetirizine and mesolastin. These are the drugs which show minimal pharmacological actions, and there are drugs like chlorpheniramine, hydroxyzine, or tripolidine and cyclizine. These are the drugs which show very low pharmacological actions. These are the anticholinergic drugs. The grading of these anticholinergic drugs are given based on the pharmacological actions they exert. These the therapeutic uses, or else we can say the additional uses of these histamine receptor antagonists are, apart from antagonizing the histamine reactions or anti-allergic reactions, these histamine receptor antagonists also show anti-motion sickness effect. The drugs like dimenhydrinate and promethazine, these are the drugs which show anti-motion or anti-motion sickness effect, and promethazine is such a drug which shows anti-emetic effect. And diphenhydramine, orphenhydramine and promethazine, these are the drugs which are usually recommended in intravenous route and they show anti-Parkinsonism effect. And cinnarizine is a plant alkaloid which show anti-vertigo effect. And diphenhydramine and promethazine are the drugs which are also used as local anesthesia. So these are the class of H1 receptor antagonists which have additional therapeutic uses apart from antagonizing histaminergic action. These are few of the preparations and doses which are recommended. So drugs like diphenhydramine is given 25 to 50 mg orally. Dimenhydrinate is given 25 to 50 mg orally. Promethazine is recommended orally as well as in the injection form. And chlorpheniramine is given 2 to 4 gram orally. And phenyramine is given 25 to 50 mg orally or IM, that is intramuscular route. And cinnarizine is given orally in the dose of 25 to 150 mg. And cyproheptadine is a drug of, or else it is a histamine receptor antagonist which is given in the dose of 4 mg orally. So the dose or the route of administration of these drugs also depend upon the formulation or depend upon the exertion of their, or else depending upon the binding of their receptors also. So the histamine, if the histamine receptors are present nearby to the blood circulation, or they are present in the under layers of the skin or beneath the skin, then usually we give intramuscular route or intradermal route so that the bioavailability of these drugs or the availability of the drugs in nearby to the histamine receptor is more, so that it shows effective result. Pharmacokinetics. What happens if histamine antagonists are given or H1 receptor antagonists are given into the body? So these are usually given orally or parenterally. Orally or given are, as well as they are given in the IV route also. So when these are when compared to oral antihistaminergics, parenteral antihistaminergics are well absorbed in the body because the bioavailability of the drugs in the systemic circulation is more in the form of IV route. And cetirizine, loratadine, fenofexidine, these are the drugs which are excreted in the urine. But whereas fexofenadine is a drug which is excreted in the fecus. And other drugs which are antihistaminergics, they are metabolized in the liver. First they undergo metabolism in the liver and they are excreted in the urine. So, these are what happens to the antihistaminergics, or else what happens to the antihistaminergics in the brain. So brain has a layer called as blood-brain barrier. So this is a lipophilic membrane which allows which allows the entry of various lipid-related molecules. So these antihistaminergic drugs, what does they do? They inhibit the histamine to enter into the blood-brain barrier, where they causes decreased histaminergic effect in the CNS. This is how they act in the brain, and the duration of most of these actions are 4 to 6 hours. But they show rapid onset of action. Once they administer, they exert their action, but this duration of action, or else the action of these antihistaminergics, lasts for about 4 to 6 hours, and they induce cytochrome P450 liver enzymes. So these histamines, cytochrome P450 are such an enzymes which causes metabolism of various molecules in the body or in the liver. So these histaminergic antagonists, they cause, or else they potentiate the release of these cytochrome P450 enzymes, where better metabolism takes place. Therapeutic uses. What are the therapeutic uses of these H1 receptor antagonists? So first one is like allergic rhinitis or allergic conjunctivitis. Whatever the allergic reactions, conjunctivitis is a disease which is related to the eye, where it causes inflammation or redness in the eye, and it causes watery eyes also. So allergic conjunctivitis, or the conjunctivitis which is caused because of the allergens or allergic reactions. Allergic rhinitis. Rhinitis is a condition where it causes inflammation of the mucosal membrane of the nose, and various other allergic reactions which are done or which are observed in the body can be treated by these histaminergic antagonists. Various other uses also we saw in the previous slides only. It shows anti-emetic effect, anti-vertigo effect, anti-motion sickness effect, anticholinergic effects based on the drug which is intake. The first generation, we saw 2 generation histaminergic and H1 receptor antagonists. So H1 receptor antagonists show first generation H1 receptor antagonists have various adverse effects. The adverse effects of H1 receptor, first generation H1 receptor antagonists include, they are highly sedative. The classification itself indicates that they are highly sedative, and they cause dizziness, they cause drowsiness, they cause fatigue, they cause weaklessness, or they produce restlessness in the patient, as well as it causes anti-muscarinic effects. Anti-muscarinic effects are nothing but anticholinergic effects like dry mouth, constipation, over secretion, and blurred vision. These are the peculiar anticholinergic effects. So these are observed, or else these are observed as adverse effects or side effects of these first generation antihistaminergic H1 receptors. What are the drug interactions? or when can these H1 receptor antagonists, first generation H1 receptor antagonists should be contraindicated. So these should be contraindicated with opioids, sedatives, CNS depressants as well as alcoholic patients, because when these H1 receptor first generation H1 receptor antagonists are given in these conditions or along with these drugs, they potentiate the actions of these drugs, thereby leading to reverse or adverse reactions. Second generation antihistaminergic side effects. The adverse effects of these second generation drugs include, first of all, they show less adverse effects when compared to first generation drugs. But drugs like terfenadine and estimazole, these are the drugs which show an adverse effect called as torsade D points, which is related to antiarrhythmia. So in antiarrhythmia condition or where there is disturbances in the heart rhythm, usually the impulse is conducted in the form of circular motion. But in that pathway, or else if there is any obstruction in the pathway, the impulse is recirculated in the blood vessel itself. So this kind of condition is observed with few of the drugs, and this condition is called as torsade D points. And this torsade D points is observed with second generation antihistaminergic H1 receptor drugs. What are the drug interactions? These second generation H1 receptor antagonists should not be given with fexofenadine and loratadine, because they potentiate or else they produce synergistic effect, and they produce anti-muscarinic effects also. These drugs should not be given with anti-muscarinics or anticholinergics, because they show high or else they potentiate or else they show synergistic effect of these anti-muscarinic drugs like dry mouth, constipation, blurred vision and increased secretions. And these also should be contraindicated in opioids, sedatives, even though there are weak sedative drugs as well as non-sedative drugs. So non-sedative drugs can be recommended in these conditions, but weak sedative drugs should not be given with opioids, CNS depressants, sedatives and alcoholic patients. Second generation H1 blockers are more recommended than first generation H1 blockers. So second generation H1 blockers we saw in the classification itself: fexofenadine, loratadine, cetirizine, levocetirizine, azilastine and terfenadine. These have various uses, like they are used in allergic rhinitis, allergic conjunctivitis, they are used in common flu and cold, they are used in urticaria also. These second generation antihistaminergics are more advantageous over first generation antihistaminergics. First thing is like they are less sedative when compared to first generation H1 receptor antagonists, and they do not cross the blood-brain barrier, or else they even won't allow the histamine to cross to the blood-brain barrier, where minimal or no effect of histamine can be observed, and they do not impair psychomotor performances. These second generation drugs do not alter in the CNS effect as observed in the first generation drugs, and H1 receptor antagonists are more preferred to H2 as well as H3 receptor antagonists.